Deputy Sean Kyne is next. 5 minutes.
Gormagat Lascan Corla. I do welcome the publication of this Public Health Sunbeds Bill and warmly welcome it. Early this month, the United Nations International Agency for Research on Cancer presented research showing that the number of cancer cases will rise by 50% by 2013, just 16 years away. And cancer deaths globally are likely to rise from 8.2 million per year to 13 million. And these worrying figures have been compiled by teams of more than 250 scientists from over 40 countries. Several reasons are being put forward for this surge in cancer cases, including the ageing population of many member states as well as growing populations. However, behaviour is also cited as a factor, and included amongst this category is the use of sunbeds. For over half a century, we have known that there is a definite link between certain behaviours and cancers. Smoking is one such behaviour which, despite the initial denials by manufacturers, obviously causes cancer, as we all know now. Without doubt, the use of sunbeds is also a behaviour which substantially increases the risk of skin cancer. Skin cancer is the most common cancer in Ireland, with the skin type of the majority of people in Ireland particularly susceptible to the disease. The Irish Cancer Society's findings that 9 out of every 10 cases of skin cancer is caused by ultraviolet rays from the sun or from sunbeds demonstrates the higher risks that most Irish people face. The statistics provide further evidence and show the alarming increase in the incidence of melanoma by 137% between 1994 and 2010. And yet much of this risk can be avoided. We need to realise that wearing sunscreen or sun cream is no longer just for when travelling to foreign places. We also need to realise that by using sunbeds, we are putting ourselves at ridiculous risk of developing life-threatening cancers. The effects on children are even more pronounced. When parents permit their children to use sunbeds, they are increasing the risk of their children from developing skin cancer by 75%. And this is a statistical fact that cannot be disputed, and it should serve as a startling wake-up to anyone using sunbeds. Ideally, the government would not have to regulate the use of sunbeds. Parents and guardians would know better and would realise the potential harm. In legislating for any issue, there is a balance to be achieved in promoting the common good and in protecting or respecting individual persons' rights. To be very clear, the World Health Organization has classified sunbeds as belonging to the highest cancer risk category as tobacco and plutonium. Despite this, some people go to great lengths to get the so-called healthy glow. And more ludicrous still are the efforts to which some parents go to have their children use sunbeds, even when it is common knowledge that children have sensitive skin and are therefore at even greater risk of developing skin cancer. So, armed with the evidence of what is happening, it's clear that the government has a duty to step in. The World Health Organization's International Agency for Research on Cancer provides the following advice to parents, policymakers and health planners. And I quote, "Lessons from cancer control measures in high-income countries show that prevention works, but that health promotion alone is insufficient. Adequate legislation plays an important role in reducing exposure and risk behaviours." End quote. The Public Health Sunbeds Bill 2013 is, I believe, a vital legislation to help reduce the risk and exposure to skin cancer. Indeed, the Irish Cancer Society refers to the bill as life-saving legislation, which is completely accurate. As a result of medical research and evidence, and as a result of concerns from parents, guardians, health professionals and others, this legislation is being enacted to ban outright the use of sunbeds by persons under the age of 18. It rightly contains other essential provisions to ensure persons are informed and forewarned of the potential and likely dangers and risks. It also prohibits ridiculous and groundless health benefit claims that some sunbed operators make. Marketing nonsense can be very powerful, and we're all susceptible to it, which is why accurate, verified information is essential to help people make informed and wise choices. I suppose there are a number of issues, and others have touched on it, Minister. The HSE is to be instrumental in the enforcement of the regulation, that will be responsible for the registers and for appointing authorised officers. I would have concerns, and they're highlighted in other countries such as the UK and Australia regarding the enforcement. Enforcement and compliance has been problematic in other jurisdictions, and how we ensure what measures can be put in place to ensure that someone who says they're 18 is in fact 18. And you see similar issues in relation to nightclubs, which obviously every person in a nightclub maybe not unfortunately be of legal age, despite the measures put in place there. I also, and I know it happens in Australia, for example, in Victoria, any person with a very fair skin of type 1 and type 2 is not allowed to use tanning salons and that every client must have a skin type assessment made prior to using a suntanning facility. And I think that should be looked at as well, because obviously those with the fairest skin types are most susceptible and most prone to melanoma and most prone to skin cancers. This bill also provides for the control on the remote sale and hire of sunbeds, and I welcome that, and a requirement that sunbed operators provide training for staff, which again I fully agree with. I mentioned the enforcement, an obligation on all sunbed providers that they would provide protective eyewear, and that all sunbeds are maintained in a clean and hygienic condition, which obviously I welcome very much as well. Warning signs also are very important for these premises. And as I said, the prohibition on certain claims being made by people in relation and regarding to the benefits such as they're alleged to be regarding these, and also the prohibition on promotional marketing practices. So I think this is a very welcome bill. I think we see it's getting cross-party support, and I think that is welcome. Obviously the protection of children is hugely important, but I would reiterate my concerns regarding how this will be enforced, because rules and regulations are fine, but when someone rushes into a salon, either with their parents or individually, who may not be 18, what measures are going to be in place to ensure that if that child is under the age of 18, that they won't be able to use these facilities. And that is of concern, and I'm not sure how the HSE are going to enforce that. There are issues with enforcement on a range, and I know of a range of other legislation, other acts, and I know that obviously the HSE have a lot of different pressures to deal with. So I'm just wondering where they will be able to ensure that this is looked after. And again, I reiterate the concerns about skin type that I've highlighted in the case of Victoria. And the Irish Cancer Society, who has stated that they would prefer if nobody, in fact, used sunbeds. And the evidence showed that sunbeds are a risk for every skin type. And people would, as I said, with type 1 and type 2, have double the risk of developing skin cancer than people with type 4 skin type. So that is a concern, and obviously, we've heard people talk about forcing people, putting in place rules that is forcing people to do something. I think when you look at something that is as important as this in relation to saving somebody's life, or the potential to save somebody's life, I think it's more important that we provide that level of protection. So overall, Minister, I'd like to commend the government for introducing this very important bill. Good morning.